I'm Michael Lazaris, one of the veterinary surgeons at RSPCA Putney Animal Hospital here in London. The coronavirus pandemic has obviously provided quite a challenge for us as we need to remain open as one of the RSPCA's biggest hospitals. We've always provided emergency care for clients in London and for stray animals that have been abused, and British wildlife. So unfortunately, that doesn't stop during a pandemic. The most important thing for us is making sure that our staff are healthy and safe. So luckily we do have lots of PPE that we're able to use when it is needed. Obviously we're still quite cautious about preserving PPE, you don't want to waste it. But we're mostly using it between ourselves and clients, and in veterinary cases, where infectious disease is quite likely that could spread to us or to animals. We are obviously trying to reduce the number of clients coming to the hospital, so we've completely stopped all routine consultations and routine surgeries, which means that we are relying heavily on phone consultations. So a large part of our day as vets is now doing phone consults, triaging animals and pets and seeing if they're sick enough to come to the hospital and continue getting veterinary care here, or whether we can prescribe medication remotely through prescriptions, which means that it's safer for the clients and safer for us working here every day as well. One of the big scares that our clients have had is that they are worried coronavirus can be spread through their pets, or their pets can catch coronavirus. And currently there's no evidence to suggest that coronavirus can be transmitted by their pets to humans. So there really is no need to worry. We've had quite a few people call being concerned about that. But just the most important thing is to read information and articles from trusted sources like the NHS and the government, because there's a lot of fake news going around. We are trying to keep our staff levels as low as possible to prevent any transmission, because obviously if all the vets and nurses and hospital assistants, receptionists get sick at the same time, then we won't have anyone here to run the hospital and treat the animals. So we are having to be mindful about how many people we have in the workplace. Social distancing, even though that can be quite difficult when you need someone to restrain an animal for you when you're taking bloods or placing an IV catheter. So some situations are quite difficult to maintain social distancing in a vet hospital, but we are doing our best. We still have to provide a 24-hour emergency service, as animals don't stop getting sick during a pandemic. So we have our inspectors bringing in stray animals, bringing in cruelty cases, wildlife, and we have to have vets and nurses on site 24/7 as well to receive those cases and to treat them. But overall, we're quite happy that we can still come into work and continue doing our job and protecting animals and maintaining a great level of animal welfare that we've always been proud to uphold. But we're just hoping that we don't all get sick around the same time, because then we'll have quite a big issue starving the hospital. But fingers crossed we don't get to that point. But yeah, that's it, and just stay safe, everyone.